How you guys doing? I'm gonna put the comments on. So, did you guys get those thumbnails that I put out there? I actually put a couple of thumbnails, a couple of shorts, and I already put the thumbnail out there for Friday. That schedule that you guys already see out there is here. Okay, I put it out there in the thumbnail, and it's pretty much what we're going to do in the beginning. So the Monday, Friday, and Saturday that we have scheduled. That's what it is. So I just kind of put that out there so you guys can see that. So today we just want to kind of talk about the books that you need, right? Because you already got that 3 o'clock. I dropped that at 3 o'clock. Okay, so you guys should have that already. Um, I want to go over the orientation video. There's an orientation video in my playlist. It's a short one, and that one's a little bit different than this one. So we're just going to kind of go through this, and I'm not even going to talk through it. I might say a couple of things, but I just want you guys to get the gist of what this program is, what the program is about. Okay, so we're just going to kind of go through it like this is just your welcome that we're going through. Okay, and I'm just pretty much generally going to go through it. You can archive this video, then kind of backtrack, and just tells you, about the lessons that we do in the classroom. So it's just kind of getting you familiar with what we already do. But being that we are bringing it to YouTube, it'll be in a little bit different format, but pretty much the same. I have to make it not so in depth on YouTube. So we're also going to finish up chapter one, and then we're going to go into chapter two. Okay, and again, this is just a welcome, just letting you know about Sapphire. This one I don't think I've ever put on. I'm just throwing this one on because we haven't done this one yet. This one is normally inside of the classroom. And again, it's like the mission statement and a couple of other things. You guys actually already have that stuff. Okay. You guys can take a look at that if you want to. I'm just going slow, just kind of moving through who we are, just telling you what Sapphire Physician Coding is, what type of programs we do. So this email here, I made this email specifically for YouTube. We have a school email, but that's generally for the students and for us to use in that portal. This just telling you a little bit about the program. And again, you guys can leave a message that you want to me in regards to the program. I know I forgot to put my little background on, and I don't know how to do it now, so it's a wrap. So yes, we do Zooms, Facebook, and these type of things is called discussion board. We call them discussion board. So we got Facebook, we have Instagram, we have all the social media ties, TikTok. I don't know. I guess TikTok is still around. They may be changing it a little bit, but Sapphire creates ways for students to learn and ways to communicate, and these are it. And remember, this is generally for students that are in the classroom, but I'm just kind of giving you guys an idea of how we run the classroom. Now the YouTube, don't forget, you guys, you don't have to purchase the courses unless you really want to get in depth with the program. If you want to just look at those 70 courses, you can. And again, you can pause this anytime you want to take a look at this. And these are like estimates, especially the 2 week on the fast track. So some of you guys who are on a 10-week course, you guys are on a 10-week course because the fast track course, you are doing it on a double time. Okay. So I have the schedule for that. This I will not post on YouTube, but this is what I am actually going by. So YouTube doesn't really need this. You guys have this. My Sapphire students have this actually in the portal. Okay. So whatever I post on the YouTube, that's what you guys are going to have on the YouTube. Okay. And this is what you need. Some of the things you need: laptop, desk, phone. Something that you can use to do PDF files as well. I got this little thing in the corner. Don't ask me how to get it off. It's a wrap. I don't even know how I got that thing on there. Okay, so you get class introduction, orientation, PowerPoint, syllabus, description, class outline, assignments. Remember, this is for the Sapphire students, not generally YouTube, but because I'm giving it to you same as YouTube, your access will be through YouTube. You want to look at this, you go through the chats and find, I think, what is this, episode 2? CLS 2. Manuals. Look at the video that went out today about the manuals, okay? Students' lessons will be in PDF format. Okay, this is just giving you an idea. That's why I'm just going to go through this quickly. Um, you guys don't have some of this, but it's pertaining to you guys on YouTube. This is how you're going to do your work. Okay, this is how you're going to keep up with your work. Even when you guys are doing your medical insurance billing, if you guys are writing a summary or something, keep up with it in your book. When you do your test, make a file for it in your book. I don't know what that is. Remember what I said, discussion board is everything. I'm talking about the videos. So the videos that we do on YouTube, I put them in the classroom as well. Not all of them. I mean, I'm not going to put 400 in the classroom because after about 4 or 5 months, they should delete. So I don't have a whole bunch of videos in there. The videos on YouTube stay. And don't be precarious about the videos being gone. I still have all the videos on my what do you call that thing? My flash drive. SapphireCoding.com. Go on that. Go to click on the books, and you guys can see the bookstore. Again, the program allows students to purchase courses individually. You can get any course you want. Remember, the training is free. And like I said, I'm just flying through this. You guys can, of course, go back through this if you want to. Course finals and competencies. You can get the same thing. If anybody on YouTube, you finish your course and you want one of those competencies, I will give them to you. You guys already have this. This should be in the description below. Objectives, CPC. The purpose of this class is for you to pass your CPC. Your lessons is 150 to 300 hours. Completion time may vary. I have students that do like 4 classes a day. They finish fast. Book, flash drive, scanner, whatever you need. So this is the practice and the theory, okay? So YouTube will get the same as the other students. Just, some of this is just limited to you, that's all. Testing, there's exams, quiz, competencies. In your CPC book, you have a ton of tests back there as well. So when you guys buy the CPC book, you can test yourself. Test yourself after you finish with your step-by-step book. Set a goal for yourself. Tell yourself, I'm going to study for 1 hour and I want to make sure I pass this test. I want to pass that test. Let me go to chapter 2. I want to pass this test. Practice, 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 okay? They have an attendance portal in there. We don't need that for YouTube. All right, stay focused. Thank you. Welcome. Okay, it should be 60 slides and we're done. Okay, so Generally, now you guys can look at this anytime you want to. Okay, anytime you want to, you can look at that. That was the purpose of me actually putting that in there. Okay, so now let me go to. I'm sharing my screen, I guess, with myself, but we're just going over where we left off at. So, because I can't go through this too much, it's a copyright on it, so I can go through some of it. But again, um, Saturday, why did they do this? I got to go back to my library. Hold on, y'all. Okay, so Saturday we were going through medical insurance billing, right? Um, we're just kind of finishing going through chapter one, and it was pretty much us just pretty much talking about what's in there. So I'm not going to go over that again. Um, we did the first chapter, role of an insurance billing specialist. The last one we didn't get a chance to touch bases on was compliance, fraud, and abuse. Okay, so I hope you guys are able to get your books. You still have time because guess what? You can archive this just like a regular school. When you go in and you missed the chat or you missed the slides, you go back and archive them. Just think of this as slides and an archived class. How about that? So, compliance, let me get this out compliance, fraud, and abuse. Okay, so those of you who do have your book, that's what you're going to go over. You can follow this the way I'm doing it just fine. We are doing. Let me take a look at this. I hope you guys can see me. So, chapter one, role of an insurance biller. Chapter two, privacy and security. Chapter three, Friday, compliance, fraud, and abuse. Because I have to go over that again. Claim submission is chapter four. Okay, and Tuesday, let me see, Friday. That's supposed to be Saturday. I don't know why I have Tuesday. Um, Chapter 6, Healthcare Facility and Revenue Cycle Management. So I have Friday and Tuesday. Okay, so we're going to do that one on Tuesday. I'm still going to come back on that Saturday and we're going to do the other one. Okay, so compliance, fraud, and abuse. This is still another one that's actually in chapter one. So make sure you go over that. Anti kickback, go over that. I can only mention a couple. I can't like word for word from the book, but when you get your book, this is what we're going over. Okay, corrective action plan, cost reports, criminal false claim act, false claims. Okay, healthcare fraud and abuse. This is a good chapter. When you guys finish with this OIG work plan, that's Office of Inspector General. Make sure that you do all of the exercise because remember, you guys do not have the test. Okay, do the exercise in your workbook. Clear. Oh my God. Make sure you go over clear. More than likely, the question on your CPC is going to say, "What is clear?" Okay, you have to give the definition of that. You might get another question that says, "What does it do? How is it perform? What is the discount? What can they charge for? What urine test? What dipstick?" So make sure you guys get that down pat. These every time you see these key abbreviations, you can't see them, but I'm telling you. Hopefully, you have your book and you are going along with me. I'm on chapter one, and I'm going through compliance, fraud, and abuse. Okay, so clear CLIA. Make sure you take heed to that and put it on your index card. CMS, DHHS, DOG. Make sure you take heed to those. FDIC. Make sure you take heed to that. MAC. Make sure you take heed to that. So remember, there's two different MACs. There's one for anesthesia and there's one for the billing for Medicare. Okay. OIG. We did that. OSHA. RAC. Okay, I want you guys to make sure you remember those things. Okay, that's a part of you going over the book. So let's say we started Saturday, but generally we're gonna go move forward for today. So for today, do the two chapters, do one and do two. So do the exercises in one, do the exercises in two. You finish with those two chapters. Friday, you're going to do three and four. Okay, three and four. I've got Tuesday, so Tuesday is when you're going to start the 5 and 6. Saturday, finish up 1, 2, 3, and 4. Make sure you do the exercises, okay? since we have that one already. Now, when I make the schedule for next week, I'm going to make it how I had it in the beginning: Monday, Friday, and Saturday. Okay. All right. So I can't say a whole lot in this book, but again, you guys know the book, 40s Medical Insurance and Billing. Okay. Make sure you get the book. Okay. I'm on page 40 right now, and it's pretty much just talking about compliance defined, patient safety, and stuff like that. Okay. Now there's quick reviews down here. Make sure you do them. Department of Justice, DOJ. So when you guys do it, you guys give me a summary with Department of Justice, DOJ. Okay, y'all can send it to that email, Sapphire Physician Coding at gmail.com. If you got a test that you want me to try and want me to grade for you, let me know. But those answers should be in the book. Okay. If you want the material from the Sapphire coding class, you guys have to go through sapphirecoding.com, hit the bookstore, and you get those. You can get those courses, or you can just buy the whole thing. Okay. So let's go to. I don't want to go there yet. Oh, phantom bills or invoice, ghost bills, services that were not done. You guys make sure you take heed to that. Okay. And again, we're in medical insurance billing, split billing claims. Okay. Change of dates of service, soliciting, kickbacks. This is what we're in. Okay. We're on compliance and fraud. Okay. So just a quick overview. You guys are going to do that chapter. Okay. And chapter 1, career role and responsibilities, actually has 1, 2, 3. All right. So there is 3 sections in there. Okay. There's 3 sections in there. Role of an insurance billing specialist, private security and HIPAA, compliance, fraud, and abuse. Okay. And don't forget, you can go get your book anywhere you want to. You don't have to get a brand new one. Okay. You don't have to get a brand new one. All right. So what is that? Something beat me. Something flying around in here, y'all. Flying around in here. Okay, so introduction to health insurance. 2. What did I put for 2? Privacy and security, data, HIPAA. All right. So that's still in here. Okay, but we're just going to continue on with 2, introduction to healthcare. I'm just going to slide down. So I do want you guys to take heed to that. Just make sure that you have your book. Let me open this up. Okay, yeah, make sure that you have your book. Okay, basics of health insurance, the blue plans, private health insurance, and managed care. Okay, it seems like a lot, but it's really not. This is just medical insurance billing. There's only 18 chapters. 18, wait a minute. It might be 13. Whatever it is, one, you're not going to do the job one. And then I think those 2 chapters at the back, you're not going to do. Let me see. Because I think they got a job development one that used to be in here. Yeah, it's still in here. So that's 7. You're not going to do that one. That's 7. You're not going to do that. So don't worry about that. Let me see. Yeah. That's the job one. So we know we're not going to do that one. Okay. Yeah, I wouldn't worry about that one. Two has a lot of sections in it, so we definitely want to take care of those. So I'm just gonna go back up there. So if you guys got your book, just kind of follow along. So this is your introduction to pretty much health insurances. Blue plans, private insurance, managed care plans, Medicare, Medicaid, and other state programs. Okay, we're not reading anything, so we're not doing any copyright. These are like verbal words that I can say: Tricare, Veterans Health, Workers' Compensation, Disability Income Insurance, and Disability Benefit. Now, if you don't know anything about medical insurance billing, this is your go-to book. Okay. Medical Insurance and Billing by Linda M. Smith. You have to get that book. Okay. Everything is in there. Okay. If you finish, you as doing self-taught stuff, let's say you go to a place and you put in your application, they go, okay, we'll hire you. Before they hire you, they're gonna give you a test. Okay, maybe they say, well, okay, well, you don't need to have like a associate degree or certificate or CCB license or whatever, but can you pass the test? Sure, I can. You better make sure you take heed to what's in here. Okay, you see what I'm saying? Because a lot of times, especially private doctor's offices, They don't always go by the rules, okay? They don't always go by the rules. They may hire somebody and train them to do what they want them to do. Okay, so in introduction to health insurance, okay, is basic health insurance. Y'all want to talk about that? The blue plans, private insurance. Private insurance is like United Healthcare and stuff like that. Cigna, Medicare, Medicaid, out of state, other programs. Y'all know Medicaid is not really an insurance; it's like an assistance program. Tricare, veteran health care, workers' compensation. Okay, so we went through that already. So in that chapter, that's what you're going to go over. Okay, so chapter 1 and chapter 2, I want you to finish those before Friday. Finish the 1 and 2 before Friday, and then when we go over the 3 and the 4, you should be ready to go with 3 and the 4. So just try to have that work done. That way you can be completed. Make your schedule. Make your own schedule, or look in the chat. So you'll find the schedule that I already have in there. Okay. So let's move on to 3. Okay. I'm going to chapter 3. Chapter 3, I just put a couple of things in there, compliance, XYZ, but we're still on chapter 3, documentation and coding for professional services. Now, y'all remember there was like a little part that I had in it, that they have in this book that has to do with coding. It does have a little introductory part about coding, medical documentation and electronic health record, ICD-10-CM coding, CPT coding, HCPCS level 2 coding. Why, Miss Lambert? Because the medical billers need to know something about coding. Okay, so you guys are also introduced to coding. Okay, do you need your ICD-10, HCPCS, and CPT? Yeah, you still need it, even if you're not going to go forward. So some of you who just want to know the medical billing, maybe you're already working at the hospital, maybe you're in the front desk, maybe you're in housekeeping, maybe you're in volunteering, and you want to work for the hospital. You still need to get those books because you have to do your study there. Okay. So I'm just going to read a couple of them. I can't do all of the objectives, but when you get your book, this is what you're going to work on. This is for Friday. Okay, y'all. Identify the most common documents found in the health record. Okay, we talking about electronic health records right now. Understand why complete documentation is important. Okay, I'm skipping down the line. Explain the purpose of clinical documentation improvements. Okay, describe signature and requirements for documentation. Now, in the Sapphire portal, yes, I can go over this word for word. I cannot go over this word for word on YouTube. So again, you want to join the class, sapphirecoding.com, go ahead and get the courses and let me know. But right now, I'm putting you guys in the right place. Some of my Sapphire students, I'm going to set different days for you. I haven't set them yet, but for right now, these days are going to be the days for you guys on YouTube. That Tuesday should be Saturday. So I'm going to coordinate the same thing. We start the same thing in the classroom. Okay, so some of y'all who are in the Sapphire classroom, and y'all get ready to archive this, I haven't made y'all schedule because y'all come and go. Okay, y'all come and go in there when y'all want to, and when y'all want me, I'm in there. And if you guys missed the chat, y'all know to archive the chat. But I'm going to set a different schedule like this for you guys as well. Okay? Because sometimes y'all can't get on. And then when I'm doing share screen like this, I can't really answer too many questions. Okay? So, describe the difference between prospective, concurrent, retrospective review of records. YouTube, make sure you take heed to that. Because on your CPC, those of you who are taking CPC, they're going to ask you what is concurrent. What is concurrent? A patient comes back in that hospital, or the patient stays there, or he gets concurrent care. Okay? Read your book. Okay? I'm putting you in the right place. I'm giving you what you need. Okay? These are key terms for this, y'all. Attending physician, chief complaint. What is a chief complaint? What the patient has came in for. What's wrong with the patient, right? Computed tomography, right? It's either x-rays or some type of machine that's going to do some type of, I'll say, analyst. Concurrent review, consultation, consulting physician. Okay? There's a consulting physician and a PCP, right? Documentation. Okay, I can't say it all. Oh, I'm going to say this one. Eponym. It's thousands of eponyms. Yeah, you need to remember them. We'll try to remember them. Key abbreviations. ARRA. We did that yesterday, right? I mean, on Saturday. CC, CCU, CDI, CT, DX, or capital DX. There's a difference between them. EM, we know what EM is, Evaluation Management, EHR, EMR. There's a difference between EHR and EMR, guys. HIM, HIM, HIV, HP, ICU. There's thousands of them, eponyms and abbreviations, okay? I can't go through all of them, but I'm on page 205. Okay, y'all, I'm on page 205. Electronic health records, that's what you guys are going to do. Okay, don't forget, you can get your book from elsevier.com. Okay, they've got all kind of ways. I think they've got a firm, they've got this, they've got Kelly and all these other things that you can get your books from, which I think is amazing. I think it's amazing. Okay, so okay, let's go down. What's the next one? 4. We're going over chapter 3, chapter 4. Okay, I'm just kind of sliding through those, but I'm gonna stop right there because I'm not supposed to do these two until Friday. But I wanted to see what else was in here that's changed. Okay, so claim submission in the medical office. Okay, yeah, that's it. Okay, so I'm not supposed to go over this till Friday, but I did want to take a look at it. Okay, the paper claims. They should have a 1500 in here. I want to see. Oh, this might be on a test, y'all. NUCC, National Uniform Claim Committee. Ebony, that's going to be on a test. Clean claim, deleted claim. All right, hold on. Oh, yeah, so here it is. So they do have a blank 1500 in there. In the Sapphire course, there is a blank 1500 in there. I already have one downloaded for you guys in the Sapphire portal. If you do get the courses, there's one already in there, and I got it in a writable form, so you guys can type on it. And I've got a test on that. YouTube. Let me know. You guys can also get that if you go into that portal, go into that bookstore, okay? And you don't have to. If you're just doing medical insurance billing, you don't need to get the $1,300 course, because I don't have to give you that grant key code. If y'all are still with me right now, the grant key code is hashtag key 212. It takes off $1,150 off of the advanced course. If you just want to do the medical insurance billing, if you just want to do this, it can't be more than $70. I think it's $59 for this full course. Just this. If you want just this, just do the $59 course. The advanced course, that's $1,389. I always have like a grant thing for that, but it's for everything. It's for those people who are going on for CPC. Okay, hold on. What time is it? See, 6:30 already. I just want to kind of hit a couple of these before we finish. So I'm gonna go back. I just want to go back to this one. All right. So generally, we are on 1 and 2. I just hit Fridays because I just wanted y'all to be excited about Friday that's coming in, and try to get your book. Go to that's what I forgot to put that link. The link for thrift.com. That's the one, y'all. Thrift.com. Don't let me forget. I'm putting it in my book so I don't forget. Thrift. I don't know if it's thrift.com or thriftshop.com, but I just wanted to make myself a note. All right, so today we are in role of a medical insurance biller, which we did some of the other day. Role of an insurance billing specialist, privacy and security, HIPAA, compliance and fraud. Okay, let me see what else is in here. So that's the only thing that's in 1 that you should be going over. So you should be reading all of these chapters, which is only 2 chapters. Okay, do the exercise. Get used to HIPAA. Get used to what HITECH is. Okay, authorization form, business associate, clearinghouse. Remember we went over this Saturday. I'm just backtracking from Saturday. That's all, because I want y'all to be finished with this. EIN. What is the EIN? What is EPHI? DHHS. Okay. I'm skipping down to compliance, fraud, and abuse real quick, okay? Okay. So they apparently have this in two subjects because we just did it in the other subject, but they do have it in two subjects. But I wanted to see what was at the bottom of this. Okay, so that's the same. That's the clear one that we just got finished looking at. Okay, so let's move to chapter 2, Introduction to Healthcare Insurance, that we just did, but I just want you guys to make sure that we are clear on how you're going to do this and what's in here. The workers' compensation. This chapter is going to explain to you about healthcare insurances, and this is your 1 and your 2. Okay, I'm gonna stop sharing. Well, you can still see me, but I'm finished looking at this. Okay, so as you guys can see, what we need when you're starting medical insurance billing. So you're going to do chapter 1 and chapter 2. Like I said, if some of you are not going to go on to do your CPC, no problem. Go to sapphirecoding.com. Just get the medical billing course. It's a self-paced course if you're not going to join the classroom. But if you purchase the course, I can give you 100. Okay. I don't know if I would say 100% or 100. I don't know how to use that word in context, but you can have access to the portal, and that can also help you more and follow you along. Why do that? I'll be scared of this doggone thing. Okay, so again, YouTube, medical insurance billing book. Okay, you're going to do chapter 1 and chapter 2. I want you to read chapter 1. Okay, there are exercises in between those pages, and also do the exercises from the exercise book in the medical insurance billing book. Okay, so that's what you're going to do. Friday, we're going to chapter 3 and chapter 4. Okay, I got you Tuesday for 5 and 6. Okay, and that's only because I already put that out there. It's supposed to have been Saturday, but don't worry about it. We're still going to have Saturday. I'm going to have something else probably on Saturday because I don't want you guys to get confused. So we're going to leave that exactly how it is. We may touch bases on medical terminology because some of you guys have a 10-week course. This is for Sapphire students. You guys have a 10-week course, but you guys are on the schedule. The first week of the schedule this is a true schedule. This is the Sapphire schedule, so they go by. The first week is your orientation. We just did orientation for YouTube 12 minutes ago. Okay, it's not a long, hard thing for you. You look at it, that's the orientation. This is what's in the program. There's also a short orientation in there, and in my YouTube, there's also I have like a little commercial in there as well, kind of tells you about the program as well. Okay, so in this schedule, the first week is orientation. Remember, there's no dates on this, and it kind of just tells you what to do. So if you're on a 20-week schedule and you're bucking for 2, you're doubling. Okay, so medical terminology, step by step, and medical insurance billing 1. So if you're on a fast track course, right? So you do medical billing, right? So you do medical terminology, chapter 1, right? It says student is to retrieve files. You see, that's why this one, YouTube, remember, this is a Sapphire course. They going into the portal, but I'm just telling you what you can do, and it's the same. It's not the same thing, but it's almost the same thing. But you're doing the same work. You just don't have the other work from me. So YouTube, if you do medical terminology, right? If you do step by step chapter 1 and medical insurance book chapter 1 and chapter 2, you will still be on this same schedule. You will be on this same schedule. Okay, so this is the same schedule that I'm putting you on. I just can't put it on. I can't put this on YouTube, but I'm putting you on the same schedule. If you want to learn quickly, okay, how do I learn medical insurance billing quickly? How do I learn coding quickly? You need to follow this. So we are up to medical billing 1 and 2, right? But if you want to do more, you need to have your books. You want to start on medical terminology? I'll probably do that. I'll probably do that one on that Saturday that we missed. I just went over medical terminology, chapter 1, step by step, chapter 1, start step by step. Okay? Medical insurance, chapter 1 and 2. We're doing that now. Okay? Medical terminology, right? Chapter 2, medical insurance, chapter 3 and 4. That's Tuesday. That's Tuesday. We don't have class Tuesday, you two. But next time we have class, it's Friday. Okay? And those of you, we're going by the slow schedule. But this is a fast schedule. So every time you look at these chats and you see this and you know this is a fast schedule, you can say, well, Miss Lambert, if I do one here, one there, one, no, you can't. You can't do all like that. Okay? If you're going to do more, I want you to go by my schedule. YouTube, I can give you this schedule. Okay? I can give you this schedule. I put them, see, this is too much for me to put on here like this. But this is for you, okay? I will not do YouTube that many times. I have to do work. I ain't got that much time. This is in stone, okay? Minus the Saturday. This is my school schedule. Can I put this on YouTube? I did have one that I put on YouTube. I don't know whether it's this one. No, I might have done that in the classroom. I think that's a Zoom that I did in the classroom. But this is what I'm telling you. If you want to move faster, you're just going to do more. You're just going to do more. Okay? So let's say Wednesday. If Wednesday you would do medical terminology, right? Medical insurance billing, and the exercise, medical insurance book 5 and 8. And this is just speeding you along because you're doing medical terminology chapter 2, medical terminology chapter 3, and you're all the way up to medical insurance billing book 5 to 8. But you don't have to if you don't have your books. So that's why I started everybody with medical terminology because they didn't have their book. Y'all know my hair is driving me nuts. I have to do my hair the other way. I made it flat, but it's driving me nuts. Okay, so that's how we're going to do the class. If you want to do more, you can, but I want you to kind of stay on track. The track that I'm on right now with you guys as in YouTube, we are on medical insurance billing only. We are medical insurance billing only. You should get your medical insurance billing book. Next week is going to be chapter 7 and 8, 9 and 10, 11 and 12. The week after that, we are still on medical insurance billing. After those 3 weeks, medical insurance billing is finished. It's done. You should have done all the exercises and everything in 3 weeks. Okay? In 3 weeks, medical insurance billing should be done. Okay? There's no reason that YouTube should still be doing this part. Okay? Sapphire, if you want to go on a slower pace, then you can come with us. Come on the pace that I'm on YouTube. Okay? So just remember, on YouTube, we are starting with medical insurance billing. Okay? Check out the Kindle. Kindle, like I said, has books on there that you can look at. And we're only up to chapters 1, 2, 3, 4. Those few chapters should be free on Kindle. I did put the Kindle link in the chat that we did for Saturday or the one before. So just remember that. So I'm just going to reiterate Monday, Friday, and Saturday are your general days. Okay, those are your general days. The schedule that you have right now for Friday is actually for Tuesday. That's when we're going to do that. Okay, that's when we're going to do those last 2 chapters. And after that, I have to leave it because we're still going to do Monday. Okay, which I think is good. I think it's good. But during that split on that Sunday to Monday, okay, we just gonna speed it up. We're just gonna speed it up. That's all. Okay. So it's going to be at 6 o'clock. So every course is going to be at 6 o'clock. Okay. If you guys have any questions, oh boy, do I have the thing on? I know y'all, and I know BET show is on, so y'all are watching BET. I'm about to watch it myself as soon as we finish. But again, just be precarious of that. Um, I'm going to let me just see. I'm gonna look at my screen again. Um, like I said, if you guys want to move on and move a little faster, you can. You can. Some of you guys are at home and you can do 3 chapters in one day. Go ahead. But I still want you to use index cards, take your time, and I still want you to try and retain. All right. I'm looking for a chapter. Okay, so it's three. It's unit three. It's unit three that we were looking in. That also has. I'm talking to you too, Ebony. When you get to archive this, your medical insurance billing book also has an ICD-10, CPT, and a HCPCS little training in there. Okay, so you guys can also look at that before you even get to your core courses. Okay, before you get to your core courses. The books, like I said, they all have answers in the back of them. They might be odd or they might be even. Test yourself and grade it. YouTube, test yourself and grade it. Even if you get your language and medicine book, you're going to do the exercises. The answers are there. Look in your book and see if they're odd or even. Okay, and you can grade yourself. All right. I wanted to look at that because that's three. Yeah, that's Friday. Okay, so that's Friday. So no, so I took this portion out of here and I put this portion in the coding part. But I'm gonna leave it in here because some of you are not moving on to the CPC. Some of you just want to do the medical billing coding. Some of you just want a hint of ICD-10. So guess what? It's already in here. Okay, it's already here. We're just gonna go over it. We're gonna put you in the right place because I can't do it with you here. I only can go over this 100 in Sapphire. So it is pretty much the same thing. Sapphire does their work independently, the same way you guys would do on the YouTube. They get one-on-ones. The only difference is you don't get one-on-ones, but you still get the same intake. Okay, so you still get the same intake. But again, just follow along, and I think that you will be fine with that. Um, if you have any questions, just give me a call. Give me a call. Right. Send me a message and let me know. Sapphire Physician Coding at gmail.com. Okay. Don't forget the book. Let me get back to the book. Now, I did the video with the book. What the book said. I did the video. I don't know if it was yesterday, whatever day I did it. That video has 3 parts. In the video, it sounds like I'm finished, but it was another part coming on after that. So I should have edited it, but I didn't. But I'm telling you right now, there's 3 parts to the book video. Okay? I'm going to tell y'all the books again. Medical Insurance and Billing by Linda M. Smith. Okay? Linda M. Smith. Okay? Y'all should be able to find that step by step 2025 language and medicine HCPCS 2025. You can get book or you can get whatever you want, other than the books for your test. I want you to have AAPC. Okay. I did put the thing up for. I don't think you're gonna let me go. No, I don't think you're gonna let me go. And I don't know what's that up. I wanted to look for the thing where I put the ISBN on there, but I don't see it. But the chat, what's this, Monday? Friday, the chat Friday, I'll put that up there with the ISBN, which I think I've already given you guys on the ISBN. Let me just look in here and see if it's in here, and then I can, because all the books have the ISBNs on them. From one of the chats that I gave you guys. Hold on. All right, so write this down, y'all. 9780443 108785. Okay? 978-0443-108785. Okay? That is your Fortney's Medical Insurance and Billing by Linda Smith. Okay? That is your reading material for medical insurance billing. Here is the workbook that you must do. Okay? You guys must do the workbook with the medical insurance billing. Okay? This is for you too, Sapphire. You have to do the workbook too. Okay? 978-0443-109430. You guys got that workbook for Fortney's Medical Insurance and Billing, 17th edition. ISBN 978-0443-109430. Okay, so those are the books that you must have for medical insurance billing. Okay, I'm going to give you ISBN for medical terminology, the language of medicine. Because those of you who are not in my classroom, you have to purchase this book in order for you to continue on with the medical terminology, especially if you're going to follow the Sapphire schedule they are doing. You can do that this week. There's no chat with us tomorrow, but I'm normally posting something. If you're going to do your medical terminology with your medical insurance billing work, I'm going to give you that. Let's find the ISBN for this book. If you do not want to get the book from elsevier.com, which is fine, it's evolveelsevier.com. You can get the book. I don't know if they have it from Amazon. You could always check and see if they have this book. But these books are normally purchased at elsevier.com. And I'm talking about elsevier.com for all schools, not just Sapphire. Why, Miss Lambert? How do you know, Miss Lambert? Because I worked for the school. The school that I work for, these are the books that I ordered for my students on a 13th, 14th. Well, that was when I went. How much was it? $22,000 course for medical insurance billing and coding. Okay. The Language of Medicine, 13th edition, ISBN is 978-0443-107795. Okay, that's the book y'all gonna purchase, all right? Because that's the only way you're gonna do your medical insurance billing. You got to have the book. Okay, let's run it back. 2025 by Elsevier. Okay, ISBN 978-0443-107795. You guys have any issues with that? Send me a message and I'll get it back to you. Okay. The most exciting thing that you are going to do is medical insurance billing. Okay. Next exciting thing is the language of medicine. Okay. The language of medicine explains to you the language of medicine. I don't know what other way to put it. I mean, you're going to see there are some graphic things in that book. I can't even look at it. But just get through it, follow your exercise, and you'll get it done. Your step-by-step book, follow your exercise, and you'll get it done. Okay? You can, again, test your own knowledge. There's answers in the back of the book. I'm talking to you too. Test your own knowledge. Sapphire, you have tasks. Hand them back to me, and I will get them graded. Haley, I have yours. I will send yours back this week. And you guys can send me like 4 or 5 at a time. You don't need to send me like one at a time, because I would prefer you do like 2 or 3 chapters instead of like one or so. Let's do a few more so you can kind of get through it. Okay. Again, if you want to move through it quickly and you want to start getting some of this stuff in your mind, and you're home, maybe you're off, maybe you're on vacation, do the 3 subjects. Do the 3 subjects: terminology, insurance billing, and step by step. It'll get you ahead. Okay, I have some students that are doing medical terminology and medical billing, which I think is fine, because I would rather you do medical insurance billing, medical terminology, and then ICD-10 and CPT beginning. ICD-10 and CPT beginning. And that's what it's all about. It's basically you're going to read your chapter and you're going to do the work from the chapter. Okay. I have to find out how much can we read or how much information I can give you because some of you are not going to have your book. But hopefully, by the time we get to the coding part, you guys have your book. The medical insurance billing part. Try the Kindle and Amazon and Elsevier. Because right now we are in like the mediocre parts of the medical insurance billing. But in order for us to, kind of, I can't get too in depth with. I don't know if you guys have your books or not, but I don't know how much I can read from the book. You can read a little bit. I'm not sure if I can do the screenshots from it, and because I would still be, giving you information from it. But we're gonna find out. We're gonna find out. I think my desk is too high. Um, so let me see. Let me just go back here, and then I'm gonna come back at y'all in 1 minute. Just want to see what we have down here. Yeah, that's it. So you know what? Let me give you the ISBN to the step-by-step book. I know I forgot something. Okay, because you guys need that. See, this is wonderful. Oh my goodness, the step-by-step book. Well, this is your go-to. Why, Miss Lambert? Because this is how you learn how to code. If you could see, take heed to the CPC book. Put it in your mind, CPC guide from AAPC. Take heed to the step-by-step coding guide. Take heed to Miss Lambert's Sapphire Physician Coding Program. We all are going in sync, the same in line as AAPC. Why, Miss Lambert? Because we need you to learn the same way that AAPC teaches you in that same order. Okay? If you take a look, you could see the CPC book starts with reimbursement and billing. Okay? I'm in a step-by-step book. I'm sorry, y'all. I'll just bypass. I'm going to give y'all the ISBN in a minute. Reimbursement. Okay? Step-by-step book starts with reimbursement, HIPAA, and compliance. Right? HIPAA and compliance. I know y'all don't have your book yet because we're not up to that. We're doing medical insurance billing. I'm just kind of giving you a heads up before we get there. Okay? But don't forget, if you guys want to go a little further, you can. But right now, I'm going by a 3-day schedule for YouTube. Okay, a 3-day schedule for YouTube. Sapphire, you guys have additional days, and Sapphire, I can go into more in depth with this. But YouTube, this should be putting you in the right place. Okay, so first chapter, step by step, reimbursement and HIPAA. Why, Miss Lambert? Why is reimbursement and HIPAA in a step by step coding book, Miss Lambert? Because some of that is on your CPC. You must know some of this. It's in your CPT. Even though, did you see reimbursement, HIPAA, and compliance, and your medical insurance billing book, the same thing was in there. Okay? You see what I'm saying? You still need to touch bases on that. Okay. Unit 2, an overview of ICD-10-CM. Outpatient coding, reporting guidelines, ICD-10-CM, using ICD-10-CM, chapter-specific guidelines. That's your go-to. Y'all remember what I said about the guidelines, right? CMS, CMS.gov 2024 guidelines, ICD-10 guidelines. Those are free. Pull those up. If you don't have your book and you want to touch bases on it, because you got Monday, Tuesday, and Wednesday. You got Monday, Tuesday, and Wednesday to still mess around. So Tuesday, you're going to finish your chapter 1 and 2. Wednesday, you got an open day. Do this. Do the coding. Okay, start on the coding. You can't just start in the coding. But if you want to get a heads up on it in your medical insurance billing book, move on to that chapter, or you can start from here. It's just giving you an idea of how to code. You see all those search engines? How to code. What is coding? How do I learn how to code? Right here. This is how you learn how to code. Why, Ms. Lambert, do I need to know all about chapter-specific guidelines? Because it is on your CPC. It's on your C. Just like how you guys are reading this, it's for a purpose. It's for a purpose. Okay. Chapter guidelines 1 through 10, 1 through 14, 15 to 22. You guys are going to have that already. Okay. The next one I don't think is going to be live. I'm gonna have to do it on Zoom so I can show you. We can go through that because that's not a copyright. That's something that I got off a line. So I'm pretty sure I can go over that with you. Okay, without getting a copyright strike. Okay. Unit 3. Where we at? Introduction to CPT, Introduction to Level 2 National Codes HCPCS, Modifiers, ENN, Evaluation and Management, Anesthesia, Surgery Guidelines and General Guidelines, Integumentary System, Musculoskeletal System, Respiratory System, Cardiovascular System, Hemic, Lymphatic, Mediastinum, and Diaphragm. That's the bottom of your chest right here. Digestive system, urinary, male genitals. You hear all of this? This is the stuff that's on your chest. Endocrine, nervous system, reproductive system, eye, ocular, adnexa, radiology, pathology, laboratory, and medicine. In your Sapphire Physician Coding Program, I go specifically by what you see right here. I'm sorry, you guys can't see it. You know I get carried away. Your CPC, everybody hits the CPC book because that's your go-to right there. That's your go-to. You do this to pass that test. That is why this is derived like that. That is why I made the Sapphire Physician Program in the order that it is in, because it mimics this. It mimics the CPC. So you guys understand what I'm saying? I'm saying I wish you could see this. I got a better way for y'all to see this. Because I don't think this is a copyright. I mean, everybody has this. This is not a copyright. I'm going to figure it out. Don't worry about y'all. I'm going to figure out. But you guys can go on, get the course. It's all in there. All right. So, introduction to CPT, introduction to level 2. I'm going to hit modifier real quick. Modifiers. Hello, Linda. Modifiers 22. That's a common one. 22 and 26 are common. 52, 59. She got the most common one here that we're going to go over. 62, 99, not roughly, but they still use it. Maybe you have them dipsticks or something. Okay, evaluation management, anesthesia, same thing. There's a chapter that she goes over for each and every one of these. It's 7 o'clock. Okay, so next time I come on, my hair gonna be looking better than this, y'all, because my hair is driving me crazy. I cut it and then I cut it again and then I cut it and then I kept cutting and I got carried away. Yeah, I got carried away. So, this class is over. Okay, but you guys got questions? Send me a message. You don't want to know. You don't want nobody to know your question. Send me an email, sapphirephysiciancoding@gmail.com. Okay. Don't forget the books that you need. And guess what? I don't even know if I gave you the ISBN to that one. I'm gonna take this one over a little bit. I'm gonna give you the ISBN. Hold on. Let me find. I didn't get to yet. Okay, so Buck, step by step medical coding 2025. Okay, ISBN 9780443248788. Okay, this is for my independent people. Independent people. You guys are self-study. That's what this is. It's self-study. Okay, just you self-studying just like you setting yourself up for your own career without going to college. Okay, for what? What do you need to go to college for when you can't do coding unless you're certified anyway? So what's the difference? You have to learn the basics of the code and then you have to master it. Then you can take your test. When you pass your CPC, you are master at coding. Okay, 9780443248788. Practice. It takes practice to be a master. Okay, so that is the step-by-step book. Now, let me go ahead and give you the workbook. I know I'm over. I'm supposed to stop in 1 hour. This is the workbook for step-by-step. Some of you that want to go over, this is it. I'm going to give you the ISBN for this workbook. Okay? Remember, these books are derived to make sure that you pass your CPC. Workbook, step-by-step medical coding, ISBN 97804424879-5-2025. ISBN 9780443248795. Okay? Why, Miss Lambert? Because I'm going to save you $20,000 plus from going to a college that's going to charge you that kind of money. Okay. I can show you a bursar right now for billing and coding, and they're teaching the same thing that I'm teaching you and other crap that is irrelevant. Irrelevant. The only thing that they ain't giving you no books. They're not giving you books. You paying for those books in your student loan. So what is the difference of you just going ahead and paying for your books? Just pay for your books. You want to do my course by course? Buy one course for $59. You want to buy all of them? You can buy all of them for $200 with the code. Okay? You don't have a code, you got to pay a payment plan. $13.89 is $400 every time you turn. Okay? Every time you turn. I think it's like 3 payments or something like that. If you do a payment plan, it's 3 payments. We knock off $189. All right, so that's done. I'm gonna watch the thing. I know everybody's watching it because usually I have some of y'all that come in here. None of y'all have come in here right now, so I know y'all are watching it. I'm gonna watch it too. I'm gonna see y'all next class, and it's going to be Friday at 6:00. Okay, Friday at 6:00. We are still going to have class Saturday at 6:00. Okay, I don't know what it is yet, but Saturday at 6:00 we're going to have billing classes. We're still in billing. Tuesday we're going to do billing 5 and 6. So between that time, if you guys got more time, don't do extra billing because we following this. You want to do extra something else, you can do that if you want to. Okay, you want to see what the schedule is? Let me know. Okay. I don't know what that is. Something is released. Cadillac. I don't know. Cadillac. No. Okay, so this is ending. Thank you guys so much. Do not forget, stay on schedule. Stay on schedule. I will try to be more consistent with you guys and make sure I get in at 6:00 when I'm supposed to. I will be more consistent, but I still will put other things out there. Today is Monday. I'm probably going to put something out there tomorrow. I don't know what it is, but I'm going to put something out there. But you just know that your class, your next billing class is Friday at 6:00. Okay? Bye-bye.